There are probably a lot of reasons. I'm going to give you a few of what I think are some of the reasons, and this is not meant to be a completely inclusive list. I think first of all, for many years, the focus on adults has really been much more about treatment of diseases that adults get. So right through medical school and training and through clinical practice, adult healthcare providers have mostly been focused on my patients who have a disease and I have to treat them. And although they have worked on some prevention interventions, they're a little harder to employ in the adult population. And vaccines have been more limited in the adult population. So the idea of having vaccines that can prevent disease in adults, especially elderly adults, is a really newer concept. So I'm very hopeful that as all the new vaccines that are targeting adult populations become available, we will change the mindset of prevention. That vaccines can be really important as a tool. And so I think that may happen. It's like if you have something, people will use it. So it may change the paradigm. But I will note that with an important caveat that around the world, U.S. as well, it's even more severe outside the U.S., the focus of adult healthcare prevention is not fully recognized by the healthcare community. And the importance of vaccines, especially in adults, is often deprioritized. Countries prioritize infant and child vaccination, and they have not really prioritized adult vaccination. And some of that's because of cost, some of that's because of other competing priorities. And so there's a kind of a systemic difficulty in that space that needs to be overcome as well. Recognizing the value of an adult and the life of that adult and the quality of life of that adult is something that needs to be recognized because that's where a lot of these vaccines will address is not only extending their life, but their quality and their functionality of their life as they become older. So we have to value that to understand why the vaccine should be used.